Let's look at placement of our matrix bands. So I'm often asked how on earth you can get all of this stuff into this kid's mouth at the same time. So let me show you a couple of ways to make it all work for you. So our kid obviously here is anesthetized, but we don't always have palatal anesthesia because doing palatal anesthesia is uncomfortable, right? So we are hesitant to do that, and then we worry about the clamp and what the clamp is going to do to that palatal tissue and if the kid's going to be able to tolerate it. And most people will shy away from doing a rubber dam for exactly that reason. They're afraid to put the clamp on because they think they're going to lose cooperation, when in fact what is going to happen is you're going to get the clamp on properly and the rubber dam on properly, and you're going to make your life and the kid's life so much easier and faster. Anytime we're using composite materials, we have to realize that that's a hydrophobic material. Any bit of moisture is going to cause failure of that restoration. So number one, choose the right clamp. So I'm going to show you, even though we've got a 6-year molar here, I'm going to show you how to clamp your primary molar and get your matrix system on all at the same time. So one thing I want to tell you first off is we always do some type of palatal numbing, not always with an injection of local anesthetic. More often than not, we don't do a local anesthetic injection on the palatal, but we'll do a triple mix of anesthetic. And so you have a compounding pharmacy make this, and we go in and we just dip our Q-tip in, and you just need a little tiny bit dipped into the topical anesthetic, and we rub that onto the tissue on the palatal, and then that's going to be enough to allow you to get your clamp in place. So, if your kid can't tolerate the topical anesthetic, chances of them tolerating a procedure are not very high. So keep that one in mind. So correct clamp choice. So this is a 2A, so it's nice and flat. The tines aren't going subgingival, so it's going to be comfortable, and it's tiny also. So we're going to get that onto our tooth of our typodont here and show you where we're at. So it's going to stretch out real wide. Now remember, of course, this is a typodont, and we've got rubber tissue here, not real tissue. So things are not always exactly tight on these typodonts as they would be. One I wanted to mention too, so if you notice here, I've got my clamp is ligated, because if this clamp slides off, and it's not going to slide off here because we got really a lot of cervical constriction here, but in a patient, oftentimes these teeth are very slopey and they converge towards the occlusal and they'll slip off. So you get your clamp on there, so if it slips off you can grab it, because when that clamp slides off, it will often not slide off out, it will slide off down. So we want to be able to grab it. If we're really good, what you should do is you should ligate both through the holes of that clamp on the buccal, and you should ligate through on the palatal as well, because we want to be able to grab it also if that clamp will split, and we don't want the clamp to split. Obviously you'd ligate through these holes before we start putting this in place, so we want to just go in through here. Okay, so we've got our kit all clamped up here. If you're looking for some terminology, when we're seeing our kids, we call this not a clamp, we call it a button. So we're going to put our button on with our button holder, and very often I'll show the patient at the very first visit, we'll show them, or my assistant will show them, I'll put this clamp onto my finger and I'll show them what it is that they can expect that way. So my clamp is on, my typodont here, and then I've got my dam punched. So this is a slot, so it's like a snowman slot. We're going to stretch that dam over the clamp, and we're going to just stretch over to the cuspid, to the mesial of the cuspid, and we're going to put that in place there. And then we're going to put our frame on so that it's not flopping around for us. So we'll get our frame on here, and this is a 2-person job, makes it take about 5 seconds to get that in place. Okay, so we're all in place, and I'm just gonna cover up my 6-year molar here so that it's not in the line of vision for you. So we're gonna pull that, and we're gonna make sure that our floss is all pulled nice and tight so it's not in the way for you to see what's going on. There you are. Okay, so let's look at a couple different ways of putting on our matrix bands. So I'm going to take our smallest size of matrix bands. So this one here is our premolar, and we've got a couple of options here. So these ones here have a little tab on them. So that's good if you're doing an MO, one interproximal, but if we're doing back to back, we don't like those tabs because I'll cut them off and I can't see. So we'd use the tabless ones. And so let's use this one right now, and I'll show you how that all goes. So we're gonna put it interproximal, and we're gonna go in like this. And if you're having trouble, if things are tight, and we're not tight here, I can get all the way through, but if things are tight in real life, your contact is tight, and I have my assistant take an instrument and just give it about a 45-degree torque. And while she's giving, or he's giving that 45-degree torque, what I'm going to do is I'm going to slide in, and then we just slide in, and my assistant slides the instrument out. Okay, so we've got our matrix in, and make sure that that matrix is all flat up, as flat as you can get against your tooth, because we got to get a ring on there. So let me show you a few different options for wedges, which is what's going to come next. So we've got our feather wedges, which come in this kit. So we've got, let me just close it for you, and you can see, so this is a Compositite 3D Fusion sectional matrix system from Garrison, and we've got these wedges in an extra small all the way through to a large. So they're nice, got little feathers on them so that they don't back out. So we can do one of those. I'll show you how that goes in. So we want to hold our matrix band, and I would be holding it from the occlusal, so you can't see that, so I'm going to hold it buccal and lingual so you can see it go in. So we just slide it in really nicely, and it is not going to back out for us. So we want to be sure now that our wedge is on the right side of our dam. Okay, so or of our clamp, so it's going to be up. All right, I'm going to take that one out. I'm going to show you another option. I've got this one here is an A+ wedge, and that A+ wedge, so another Garrison product. So the A+ wedge will help to control gingival bleeding. This is impregnated with a hemostatic agent, and we've got 4 different sizes in that, exactly the same. So this is all kind of coordinated and pretty dummy proof. So your extra smalls are your yellow, smalls are your blue, medium orange, and your green are your large. So we can use that as well, and I'm just going to hold it here. Again, my finger would be on the occlusal if I was doing this in a patient's mouth, not buccolingually, because you can't get your hand down the patient's throat like that. So that's our A+ wedge, and I want to show you one more wedge option for you. So this one is called a wand wedge. Where's my box for the wand? Oh, there's my box for the wand wedge. So the wand wedges, again, this is all coordinated. So these are our wedge wands. So coordinated so that your extra smalls are your yellows all the way up to your larges or your blues. So the blues work, up to your larges, which are the greens. The blues work really nice, is what I was going to say. For your pediatric patients, and these are nice because we don't need to hold it with a cotton plier. We have the little wand on here, so we can put it in that way. So I have at times, it depends where I am in the patient's mouth. If I'm real far back and the cheek is in the way, you can twist these off and just have the wedge. If I'm further forward, there's no reason to twist it off, but if you're going to twist it off again, so you kind of stabilize things, and then you're going to twist your wand, and then you just twist it off and you got your wedge in place. So that one's nice and in place. Let's leave that one in place while we do our matrix ring. So our rings are 3 different sizes. Again, our blues are going to be our best bet for our pediatric application for the primary molars. So blues are the short, orange tall, and green are wide. So we'll go in here, and we've got our ring holder, and then we're going to go in either, again, buccal to lingual or lingual to buccal, whatever it is that you can do, and get in there the best. When you're putting this in, if you're having trouble with things popping up, put your finger right over top of the tooth and press down. Take your forceps out, and then you're in place. Okay? If you want to at this point, you can contour your matrix band up against the tooth beside it, and then you can adjust your contact that way. All right, so we're all in place. If you can see, we've got the wedge is between the tines of your matrix ring on the buccal, and also in this case, on the palatal. Okay, so everything's in place, nothing's moving. I can touch this and it's not gonna move, and I can push on it. So if my assistant's in there and she's a little too overzealous with the suction and she touches it, I'm not worried. This is really nice and stable. It's not gonna fall off. This generation of rings is a really good one from Garrison for our pediatric application. This cute little invention here is a guard. So it's called a FenderWedge, and what it's going to do is it's going to prevent you from smoking the side of the tooth beside it, the one that you're prepping. So you want to put this in place, and you can go ahead and you can prep without worrying about hitting the tooth that is adjacent. So if you had to guess what percentage teeth we damage when we're prepping for an interproximal,
I'm going to say it's probably pretty high, 60%.
It's 100%. It's 100%. We can't 100%. That's from a study. I'll find that citation and put it in. 100% damage. So there you go. So just in case you think you're not damaging the tooth beside, you probably are. Okay, let's put you all back together again. So I'm going to put in my matrix band. So this is a nice narrow band. And because we don't want to go too far, up. I want to be able to be pretty adjacent so that I can see what I'm doing, get my marginal ridge all nice and matched up. So this is our nice little wedge with our little feathers on it. I'm going to put that in, and now let me put my matrix ring back in place, and then I'm going to show you a technique to restore with composite that's going to give you no failures. Not 100% failures. Okay, so ring is in place. All right, so what I'm going to do, this is what I've called a base layer technique, and this is something that I would use in a case where I've got a deeper restoration that I need to do. So I would do this on a young permanent tooth. And some people prefer this to the other method that I teach, which is a snowplow technique, because this allows for 2 layers of cure. Sometimes when we're doing the snowplow technique, and it doesn't make me nervous, but it does make some people nervous to cure all the way down to the depth of that preparation in one cure. And if you're that person, then this technique is for you. I am going to restore this with some Voco products, and we're going to start off with our Futura Bond Universal. A universal bond will work as a self-etch, total etch, or a selective etch technique, whichever one you want to use. And then we are going to use our Admira Fusion. So we're going to use two things here, our Admira Fusion Flowable, and we're going to use our Admira Fusion restorative material. And so This is actually a packable, it's called an ormesser. So this is a packable ceramic type material. So it's a unique material. And they do have this in a bulk fill available, if that's your preference. And also, let me just show you here too. I've got this in my caps warmer. So this is a caps warmer, and it sits like this. And what that really is that's a little hot plate. And that is the little container that holds both my applicator with my material in it, whether that be composite or whether that be ormesser, it doesn't matter. And then it's got little spots to hold your composite, your extra composite, if you're doing a larger restoration or multiple restorations. And this little deal here on the end here, that's for your instruments. So that's to warm your instruments. So if you're really gung-ho about keeping everything warm, then this is the way to go. So it's a nice little tool to have in your practice, in your armamentarium. All right, let's fill this base layer technique. So we are going to do, as I said, our Futura bond first. So we want to pop it where it says press here. If we do it from the back, it's easier to press, and we're going to get whatever was in this bubble, the liquid in this bubble, to mix in with the liquid in that bubble. But remember, it's not completely mixed because we still need to stir it. So I'm going to take my micro brush and I'm going to poke a hole in the silver, and I'm going to stir up here. And then I'm going to take the flocked end, and I'm going to go and I'm going to pick it up with the flocked end. I like to bend these micro brushes so that I can get in better, because I mean here it's nice, we're like up straight and down, and I could do this, but the reality is there's going to be another jaw in real life. So I like to bend them. You can get in easier. So we want to pick up our Futura Bond Universal, and then we want to put it in. So we're going to do a self-etch technique here where we're not using phosphoric acid. If this was an actual patient, I would probably be doing a selective etch technique. I don't want to make a mess with the etch on our typodont. Don't forget now, we need to put a layer, or put some air on there. We want to blow off the solvent and get a nice thin, even layer. Okay, then we're going to hit it with our curing light. So cure the adhesive for 10 seconds. And then, now this is the base layer part. So this is actually, the real name of this technique is a centripetal open sandwich technique. But that's too many words, so I call it a base layer technique. And so I'm going to go into the base of that restoration, and I'm putting a base of flowable. Now this is only going to work if you've got a nice, highly filled flowable. So you want to do something like these Voco products, which are super highly filled. You want to do something like the SDR, Smart Dent and Replacement. That's a Dentsply product, a highly filled material, so that we've got the strength that we need at the base of this restoration. The other thing that you need is you need a self-leveling material, because that material needs to be leveled down to the base of the restoration. So we're only filling, that depth is probably only 1.5 millimeters, and now we're going to cure it. So we're going to hit that with our light cure, and we're going to give it a full cure. And so this is the base layer. So the centripetal open sandwich technique, and there's some literature on that talking about how there is much less micro leakage if you do this type of technique versus the closed centripetal sandwich technique. If I were doing a closed centripetal sandwich technique, what I would be doing is I would be building up that entire mesial wall. So I would be building up the mesial wall, then get rid of my matrix, and then I've got a nice closed technique to fill. It looks really pretty, and they're fun to do, but this technique actually has less micro leakage. It's also a lot faster, and when we're seeing kids, time is of the essence. So that was part one of the base layer technique, and now I'm putting just another thin layer of flowable on there. So back to the sandwich type of snowplow technique that I show you in other videos. And this is our Admira Fusion. This is our packable. It's been in the warmer, so it's nice and pliable, easy to work with. See how nicely it flows out. And then I'm going to start shaping this. So nice instruments, LM dark diamond instruments, ErgoSense they're called. So we want this to be nice and flat. You should be able to see a little bit of that flowable coming up the sides and up to the occlusal. This is just a round ball instrument, and again, so always pushing out towards the buckle, towards the lingual, and that's how you're going to get a nice feathered edge of your material, and nice and closed. And now our most important part that we want to finish properly before we take our matrix off is our marginal ridge. So we want to do as little polishing here as possible, and we want to go in and we want to clean that up as much as we possibly can. And then we're going to hit that with our light one more time, and we're going to cure it, and then we're going to do our final finish for this. Okay, and then the final finish is just a layer of top coat. And so the top coat or sealant is the same thing that I've got at the base of this restoration. This is the Admira Fusion Flowable. So I just want to fill in if there were any micro cracks, I want to fill that in. And then I would also go here, this was not prepped, right? But we would like to seal it as well. So we're going to use our flowable as sealant material. And that's not a bad thing to do at all. The flowable materials that we have available to us generally have a much higher fill content than our sealant materials. So we like that because then they're going to shrink less, they're going to wear better, and our kids that are bruxers are going to have a lot better wear from a highly filled material. Okay, so let's say that that's enough cure for this Typodont. Now we're going to take things off and see where we're at. So our ring off, and now our wedge out, and we are going to take out our matrix band, and we're going to pull that out, and now we're going to see what kind of cleaning up we need to do